Okay, this is Dr. Cohen. I'm here with Kerry. Kerry broke her wrist in August of last year. It's now May. And when she broke her wrist, she went to another surgeon who put a plate into her wrist. And during the recovery period, she noticed, first of all, that she wasn't allowed to move it for a while, and secondary, that when it came time to move it, that she was unable to supinate her wrist. So show me what you were unable to do.
I was unable to do this.
And you were pretty much stuck.
I was stuck here, and then my ulna, in order to rotate it all, I had to push down on it, and I could tell there was some sort of a click that had to happen in order for it to move about this far, and that was as far as I could go.
Okay, and the surgeon who did the surgery told you what?
He said that I think he thought it would resolve itself, but he wanted me to push through. He was making me feel that I was doing something wrong, even though when I was in physical therapy, they were telling me something is wrong. They knew something was wrong, and I knew, and I felt defeated. I felt like I wasn't doing something right, or I wasn't working hard enough. And I'm not afraid of pain, but I wasn't able to move my wrist. And in the ulnar was definitely, there was an issue there, and I was still in a lot of pain.
Okay, so he recommended you see another surgeon.
He recommended he said, he got frustrated and said, well, I can just cast you and unpin it, and asking me, and I didn't feel comfortable at this point with him. And so I knew, he said, then you go see a specialist for a wrist. And so I started to see people, but people didn't want to take me because I wasn't 6 weeks post-op or 6 months post, so whatever it was that they needed. I wasn't far enough along in order for them to take on. They felt they were taking on someone else's problem.
Right.
And then I was told by several people to come and see you, Dr. Cohen, and I came, and you looked at it, and you could see the problem, and made me feel better that it wasn't me, that there was actually an issue going on, and you were willing to take on the surgery to fix the problem. And you went to 3 other specialists, and you told me what they said, and you told me what you said, and you had confidence that what you were going to do was going to work. And so I did the surgery, and I'm forever grateful that you have restored my ability to use my wrist.
Right, well, thank you. And what we did was we took out the end of her ulna to allow for rotation. And I'm not going to get into a giant, surgery discussion here, but it's not a common, at her age with this type of surgery, it's not a common thing that we see. So I did run it by 3 other physicians, and nobody had really seen it under these circumstances. And we went with what we thought was right, and it really, paid off well. So we ended up doing surgery. Her original surgery was August. Her second surgery was in October by me. Let me see what you can do now. So show us your rotation. Good. And then go the other way. Perfect. So rotation's pretty well restored. Not full flexion and extension, but definitely considerably improved from what she initially came in with. So I'm gonna switch over to your husband for a second, just to get his take on things. Now, you're a firefighter, right?
A firefighter paramedic, yes.
Okay, great. So just, the reason why I like to do these is I want people in the land of the World Wide Web just to know that they shouldn't feel desperate when they're told one thing or another, and that they should know that they should seek an opinion with whoever they can find that they have confidence and faith in. And I just wanted to see what was your experience with, me in the office and this whole process.
Great. So the initial concern was, and I won't belabor what my wife already said, except for the fact that she was going to physical therapy and not getting better from the original surgery. She kept telling me there's something wrong, and even she knew it. She knows her body. She's an athlete, and she knows if something's not right. Even and the physical therapist, the experts told her there was nothing, that there was a problem too. And when she finally pushed the other surgeon for an MRI, and when that came back, that's when he basically got defensive and said, just go. You need to go see a hand specialist. So we got the referral to you. We came in, we made an appointment to see you, and you did a comprehensive, a very thorough history of not only the accident, but the treatment and everything that had happened. And it took you less than a couple of minutes to realize that, hey, we have a problem. You told us straight out. You said, we have a problem here, and if we don't deal with this problem, you may not regain the use of your hand, period. And you went straight forward. You laid out to us. You didn't sugarcoat anything. You laid out exactly the potential of what could happen if you chose to cast it again, because it had already been immobilized for over 10 weeks, and you expressed your concern about immobilizing it again, and that additional time could cause her not to regain mobility of that hand, which is her dominant hand. You came up with another option, and one that you felt strong about that would work, but you were also humble enough to share this with your colleagues and even some of your mentors from the past. And although they didn't necessarily agree with your decision, they didn't necessarily disagree, but it was such a rare case that no one had really experienced or had any experience with this particular injury. You studied it, you listened to your colleagues, but you also went with what you felt was best, and you presented that to us. You also offered us the opportunity to go seek additional consultations with other surgeons. But after speaking with you and really understanding and knowing the expert that you are in your craft, we felt extremely confident with you and felt that whatever your decision was going to be the best for her. You also stated many times that you were going to push for 100% recovery no matter what, and you weren't going to stop until you got 100% or as close to 100% as possible. And what you just showed in the pictures is basically proof. I can't thank you enough for what you did, not only for your candidness, but your humbleness and your expertise in your craft, and you restored my wife's hand. She can do it. Yeah, she may have a little bit of pain stuff right now, but she can do everything. We're very outdoors people. We enjoy the outdoors. We enjoy outdoor sports, and she's back doing what she was before. And I can't thank you enough. It was a phenomenal surgery and a phenomenal recovery. And your connection with your physical therapist is also unbelievable in terms of you working very closely with the physical therapist and making sure that they are doing what's necessary for the rehab, which is a lot of doctors are hands off when it comes to the physical therapist. They just send you off, but you stay with it right away. And there were many times when you popped into physical therapy yourself and said, no, I want this, and this. She's not where I want her to be. And the fact that you take that personal interest in each and every one of your patients, that speaks volumes, not only for your expertise, but who you are as a person.
That's awesome. Well,
yeah,
thank you.
You also take really good care of your physical therapists, and they love you, and they push because they want to do well for you as well. And also, I wasn't able to hold my grandchildren, and I was worried about that, and now I can pick them up, and I'm thankful. Very
This is so helpful, and I'm so happy. This is what it's all about. And one thing that people need to know with surgery, it doesn't end when we throw in the last suture. And a lot of surgeons are very quick to do the surgery, and then you get thrown to their assistant or their PA or their nurse, and you never see them again. And with hand surgery, this is not like an appendectomy where your appendix comes out, your sutures come out, and you're done. I tell most of my people, the day of surgery is your easiest day in this process. All you have to do is go to sleep. After that, you got to work your tail off, and to your credit, you're doing as well as you are because you worked your butt off, and you listened carefully to what we told you to do, and you pushed through some really hard times, and you killed it, which is awesome. So, excuse me, you guys have been a real pleasure to work with, and I totally appreciate you doing this.
Thank you.
Thank you.
Thank you.